The majority of your activities should have at least a couple hundred hours. So for me personally, I volunteered at a cancer center and I had 134 hours of that activity. I also did some shadowing, so this is where I wish I could have had more hours, but I was only able to get 34 hours of shadowing radiologists, 8 hours shadowing neurologists, and 12 hours shadowing in primary care. I also went through a medical assistant training program. They had 492 hours of course material. However, I didn't end up actually working as a medical assistant because I chose to do a different job during my gap year before going to medical school. I would say though, if you have the opportunity to work in healthcare, I would highly, highly recommend it. There were a lot of my classmates who worked in healthcare before starting medical school, and they definitely had a huge advantage over me because they knew a lot of the terminology, the abbreviations. Some of them had studied anatomy, had done actual medical procedures. Like, they were just leaps and bounds ahead of where I was when I started medical school. So it is extremely beneficial if you have the opportunity to work in healthcare. So I would definitely recommend it if you do have that chance. And then another activity I had for clinical experience was a health fair. I was a committee member and volunteered at this health fair, and that added up to 110 hours. I also worked through AMSA to do some COVID-19 awareness volunteer work. That was 70 hours. And then I attended some medical conferences, which ended up being about 16 hours. And then I also had a lot of community service activities that were sort of related. For example, I volunteered at a retirement home, and I volunteered with a program that allowed you to write letters to senior citizens who were living in nursing homes. And then the rest of my experiences were non-medical. I hope this is helpful. Like I said, this is just an example of what I did to get into medical school. You definitely don't have to work in healthcare in order to get accepted. However, I think it really gives you a huge advantage in medical school if you are able to have that opportunity. So I would highly, highly recommend it if you are able to do so. And a lot of times people ask me how to get started with that, and I have some programs where you can get certified to work in healthcare, and they are linked in my bio if you want to check them out. If you would like any more pre-med advice or want to hear the rest of my interview with the medical school deans of admissions, hit that follow button and check the comments for the video link.